5 News starts now.
Southern Nevada has been struggling with healthcare staffing for years. The issue took center stage today at a Focus Las Vegas symposium. Business leaders, doctors, and policymakers gathered at the Orleans. They talked about how to grow our healthcare economy, from training more doctors and mental health professionals to keeping patients and healthcare dollars here in the Valley instead of sending them out of state. The Lindsay Institute says Nevada is still missing about 30% of the healthcare jobs it should have, and a lack of residency spots means many new doctors are pushed out.
As a consequence, a lot of our doctors from UNLV, from Toro, soon from Roseman, they leave the state, and we're essentially educating doctors for other states, not for Nevada.
Leaders there have called it a long-term effort that will take years of investment, but said strengthening the healthcare workforce is critical as the Valley keeps growing. Last year, nurses told lawmakers they were sometimes caring for up to 10 patients at once and pushed for mandatory staffing ratios, while hospitals warned there weren't enough providers to meet those rules. Since then, lawmakers passed SB 5 to grow Nevada's physician, nursing, and behavioral health workforces.